Are GLP-1 headaches normal, and what can you actually do about them? Yes, headaches are one of the most commonly reported side effects when starting a GLP-1 medicine. They tend to happen most in those first few weeks or after a dose increase, and the good news is they usually settle down as your body adjusts. So let's talk about why they happen, what helps, and when you should speak to a doctor. GLP-1 receptor agonists. Medicines like semaglutide, dulaglutide, and liraglutide, sold under brand names like Ozempic, Wegovy, Trulicity, and Saxenda, work partly by slowing down how quickly food moves through your digestive system. That change can affect your blood glucose levels and your hydration, both of which can trigger headaches. Many people also eat and drink less when they first start these medicines, and if you're experiencing nausea or vomiting on top of that, your fluid levels can drop further. One important thing to flag, if you're also taking insulin or a sulfonylurea alongside your GLP-1 medicine, a headache could sometimes be a sign of low blood sugar. It's worth checking your blood glucose when symptoms come on, so what can actually help? The first thing to focus on is hydration. Aim to sip fluids steadily throughout the day. Around 1.5 to 2 litres daily is a reasonable target for most people. That said, if you have heart or kidney problems, or you've been advised to restrict fluids, follow the guidance from your own clinician rather than a general target. Eating small regular meals can also make a real difference. Rather than skipping meals or eating very little, keeping your blood glucose stable with consistent, modest portions throughout the day may help reduce headache frequency. For pain relief, paracetamol is generally the first option to consider. Ibuprofen may also help, but it's not suitable for everyone. For example, if you have a history of stomach ulcers, kidney problems, certain heart conditions, or if you're pregnant, you should check with your pharmacist or doctor before using it. And if you find you're reaching for painkillers frequently, it's worth mentioning that to your GP or pharmacist, as using them too often can actually lead to medication overuse headaches. Resting in a quiet, dimly lit room when a headache comes on is a simple measure, but it genuinely helps. A cool compress on your forehead or the back of your neck can also ease the discomfort. In terms of longer-term prevention, slower dose increases, consistent injection timing, and rotating your injection sites properly may all reduce how often headaches occur. These are things your prescriber can advise on based on your specific treatment plan. Most GLP-1 headaches do improve within the first few months on a stable dose, but if they're persisting beyond 4 to 8 weeks, it's worth going back to your GP to review what's going on and rule out other causes. And there are some situations where you should seek medical attention more urgently. Contact a doctor promptly or call NHS 111 if you experience a sudden, severe headache that feels different to your usual ones. A headache with fever or changes to your vision, persistent vomiting that's stopping you from keeping fluids down, or severe abdominal pain, which could be a sign of pancreatitis. For anything that feels like a medical emergency, call 999 or go to A&E. Don't push through symptoms that concern you. So to recap, GLP-1 headaches are common, especially early in treatment. Staying well hydrated, eating regularly, and using appropriate over-the-counter pain relief can all help. And if symptoms persist, feel severe, or worry you, speak to your doctor rather than waiting it out. This video is for general information only and isn't a substitute for personalised medical advice. Always speak to your GP, pharmacist, or healthcare team about your own treatment. If you found this helpful, leave a comment below. We'd love to hear how you're getting on. And for more straightforward health information like this, give us a like and subscribe to the Bolt Pharmacy channel.